Parent and Family Engagement. And I've been with UCI for 2.5 years, very happily. And one of the great things, or one of my favorite things about my job, is that I get to work with amazing campus partners that showcase all of the amazing things that they do for our students. So that's what we're here today to share with you about student health and wellness through our UCI Student Health and Wellness Promotion Center or program. And we'll get started here just by introducing our team, Parent and Family Engagement. So I'll start off with Taylor DeLine. Would you like to introduce yourself?
Sure. Hi, everybody. I'm Taylor DeLine. I'm the Assistant Director of Parent Philanthropy and Engagement. Really happy you're here tonight. I would say one of my favorite things about UCI is our mascot, Peter the Anteater. And I do want to give a shout out if there's any incoming students here. Congratulations on your admittance and welcome.
Excellent. And Marvel?
Hello, everyone. My name is Marvel. I'm the event associate for the Parent and Family Engagement team. It's wonderful to have you here. We're going to have a wonderful time learning about student health and wellness.
Fantastic. Well, yes, so we're really excited to present this program to you and to make sure that you're well informed about the resources available to your students. We'll be hearing from Toni Martinez from Student Health and Wellness Promotion, as well as Dani Bryant and Damaris Cervantes, who will be talking from a student perspective about their experience with student health and wellness. So I don't think there's any other housekeeping items to share with you in advance, just that we'll have the speakers present their information first, and then we'll have a Q&A box where you can enter your questions. In fact, you can start entering your questions now or as soon as the speakers begin, and then we'll have the Q&A session at the end of the presentations. So let's kick it off, and I'd love to introduce Toni, pronouns she, her. She serves as the Mental Health and Emotional Wellbeing Programs Manager for the UCI Center for Student Wellness and Health Promotion, where she provides education and outreach to the entire UCI community. An alumna of UC Irvine, Toni earned her bachelor's in criminology and later a master's in clinical mental health counseling from the University of San Diego. She is a licensed professional clinical counselor through the California Board of Behavioral Sciences and has completed training in mindfulness-based stress reduction and yoga. In her free time, she enjoys practicing yoga, cooking, and chasing around her precious 1-year-old daughter. So I'd love to introduce you to Toni Martinez. Take it away.
Thank you so much, Christine, for that very nice introduction. Let me just get my screen shared. So thanks so much for joining us this evening. Tonight, I'm going to share with you about a resource for your students, and that's the Center for Student Wellness and Health Promotion. So the Center for Student Wellness, like I said, is a resource to support your students' well-being. Any UCI student can utilize our resource. It's totally free, regardless if they have the university insurance or not. And all of our services are comprehensive. We cover everything from sexual health to body image to alcohol use. And I'll get more into each topic and our specific services in a bit. But first, I wanted to spend a few minutes introducing myself, and thanks again, Christine, for that lovely introduction. But I'm the programs manager for mental health and emotional well-being for student wellness. As Christine mentioned, I'm also an alumni of UCI. I graduated many years ago in 2010, and I really loved my student experience here. So many of my job opportunities and my close friendships came from UCI. And I even met my husband here at UCI, and we now have a 1-year-old, so we're just like a little UCI family. And we would be thrilled if our daughter got accepted here in 18 years. So congratulations to the parents. I'm sure you're all very proud, and to all of the students or incoming students as well. You'll also be hearing from two of our students, Damaris, who serves on our peer health education program, and then Dani, who is one of our grad student interns. So before I get into the specifics of the work that we do, just want to share with you a little bit about the core values of our center. And they are advocacy, awareness, and empowerment. So first, we advocate for student well-being. Our team is involved in initiatives really all over campus, from an energy drink task force to policy around healthy vending and the food that's exposed and served to your students, to a national comprehensive well-being initiative that deals with wellness really on a systems level. And we deal with the built environment and, again, university policy when it comes to our advocacy. Second is awareness. So we want our students to have access and be aware of all of the resources that they have available to them here at UCI. So not just our center, but the counseling center, various cultural hubs like Latinx and the Women's Center, the different student clubs and organizations, really just helping students find community and really combat loneliness. And third is empowerment. So we really want to equip students with the skills and tools necessary to take care of their own well-being while they're here at UCI and even beyond, even after they graduate. I'm sure that we all know that wellness is really a lifelong pursuit, and it varies with each stage of life. So we really want our students leaving UCI feeling confident that they have the tools to navigate really whatever lies ahead of them. So as I mentioned, all of our work falls under 4 major topics, and those are mental health and emotional well-being, sexual and relationship health, alcohol and other drugs, and nutrition and body image. So we chose these specific topics because we know from the research and current national trends that these topics are what college students are dealing with the most when it comes to their own health and their own well-being. So we have a dedicated health educator for each of these topics, who all have at least a master's degree and all specialize in their respective field. So one example is for nutrition and body image. We have Jody. She's our registered dietitian. She meets with students one-on-one about their diet, their nutrition. For alcohol and other drugs, we have Cassie. She's our health educator for that topic, and she leads Narcan trainings for students and gives free naloxone at the end of that training. I know there was a question about fentanyl, so we definitely cover that and are definitely on top of that because we know that's a huge crisis in our community. And we have a harm reduction model too when it comes to alcohol and other drugs. And what that means is that we know that students might use alcohol or they might use drugs while they're at UCI. And so we want to just equip them with the knowledge and information to use it safely in the event that they do so or they're just in that environment. We want to teach them tools on how to stay safe in that environment. For sexual and relationship health, we have Beth, and she meets with students about safe sex practices like barrier protection and PrEP. And I cover mental health and emotional well-being. And so I cover and educate students on things like self-care, positive coping, mindfulness, meditation, time management, stress management, all of that good stuff. And all of our services are educational. So we are not a clinical office, but we do work really closely with our clinical partners like the Counseling Center and the Office of Social Work or the Student Health Center. And so if we are meeting with a student and then we find that throughout that course of that meeting, they might need that higher level of care, then we will walk them over to that office or we'll do whatever we can to facilitate that warm handoff. So let's get into the services or some more examples of the services that we have to offer to support student well-being. So we host wellness walks every other week. We know from the research that going on a nature walk can really boost our well-being. We have a condom co-op where students can receive free condoms and even do a consult with Beth, our sexual and relationship health educator. We host a regular Anteater recovery peer support group for students in recovery or have a family member or loved one in recovery. A really popular service that we have that most students know us for is our wellness room that we have in our department. And basically what we did is we just turned a conference room into a wellness room by adding massage chairs, a little tea station, aromatherapy. And so we encourage students to come to that room whenever they want, whenever they're on campus. It is tech free, so it's a nice break for students to be away from their devices and their phones and their iPads and things like that. Some students just come in and meditate or even just take a nap on our beanbags. We also do a lot of workshops around campus. So one example is our dietitian will do one on healthy eating on a budget. I do a lot of workshops around meditation and mindfulness. And really what's listed here is it's just a handful of services to give you an idea of what we offer. And really the goal, again, of all that we do and all of the work that we do is to support students, to support their well-being so they can really thrive and enjoy their time while they're here at UCI. So let's talk about our students. So like I said, you'll be hearing from two in a bit, but really our students are an integral part of the work that we do. They basically run our office, they work the front desk, they handle the condom co-op, they give us ideas and feedback on all of our workshops and programs. They do all the data analysis for our programs. And more specifically, we have sort of these three categories. So we have our Peer Health Educator program. And again, you'll hear from Damaris in a bit, and she's one of our PhDs. But this is an unpaid internship where students basically become ambassadors for the department. It's a great opportunity to learn about health promotion and get involved and really make a difference with their peers. A lot of the times when I go out and do my workshops, I will bring a PhD with me only because I know that the students and the audience are probably more likely to listen to one of their peers than someone like myself, especially when we're talking about things like health and wellness. We're also a practicum placement. So if your student is in social ecology or public health, we can be a site for them. We also have grad students who are interns as well. And we're always taking volunteers. So if a student is particularly interested in the wellness field, or they just want to pad their resume or get involved on campus, then they can always volunteer at one of our events or help out in our office. So that is student wellness. Again, just giving you an idea of the services and the programs of that we offer and really what we stand for. But if you want more information, everything is on our website. It's studentwellness.uci.edu. You can just scan this QR code and it will lead you right to the website. The website also has all of our contact information. And so if you just click on the contact us, you can see everybody on our team with our email address if one of your students wants to reach out to us. And then all of our stuff, we know students love social media. So we're on Instagram, we're on TikTok. And so you can follow us on those channels as well. And that's really where we have the most up-to-date information on the programs and the services that we have to offer. So thank you so much for hearing about student wellness and health promotion. I really want to encourage you, if you're a student, to come check us out, or if you're a parent, to encourage your student to check us out at least once before they graduate. Again, all of our services, all of the work that we do is really to support students and to support their well-being. So thank you again. So at this point, I would love to kick it over to Damaris, and she is one of our students.
Awesome. Thank you so much, Toni, for your introduction. So, as Toni mentioned, I am a peer health educator. So, as an introduction, my name is Damaris. So I'm a third year psychological science student. And I guess I'll talk about kind of my experience, my own personal experience as a student, and maybe why I am a peer health educator for the mental health and emotional well-being team, since that's the team that I'm on, which Toni is our advisor for, because I did have my own struggles definitely coming into college, but being in this program and being able to engage with the Center for Student Wellness and Health Promotion has really, really actually changed my experience in college. So going into UCI, I actually started as a math major. And I was kind of struggling. I was struggling with school. I was struggling to balance things. I don't think that I was as prepared as maybe I thought I would be. Um, and I think all the students who get into UCI are extremely bright. And you guys are parents of a lot of these students. So I probably, like your students, took lots of AP classes. I took courses that were supposed to be challenging or kind of like college prep. And it ended up being different than what I was expecting. Um, so I did struggle, and I was kind of trying to see like what path I really wanted to take. And then it took a while, and I finally decided that the path I wanted to go into was law. And maybe any of your students might have that experience where they're not really sure. But I think one of the biggest things for me is knowing that my parents have been really supportive of me. I think maybe going into the psychological science major, they had questions about, okay, well, what are you going to do with a psychology degree? Maybe they had that concern. And I think that's totally normal for parents to have questions. I think you might just want to know like what their plan is, but I think that support that you're able to provide, it really, really goes a long way. And that has been really my experience with my own parents. Shout out to them. I think they are here today, all three of them. um, but yeah, so I kind of struggled for a little bit here at UCI, but then when I really started to get involved, I think from there it got a lot better. I started to join clubs. I got involved with the PHE program. And so I applied during my second year, and now being in my third year, we're going into spring quarter, so I'm going to about finish a full year. But there are a lot of opportunities that I've gotten through this program. Actually, I have a couple of goodies that I want to show you guys. So there was a conference. Oh, hold on, it's blurred. So there was a NASPA conference about mental health, and I actually got to go to that. So I was selected among a few different peer health educators, and that was something that we had to apply for also, but it was totally sponsored by the school. They paid for our stay and many of our meals too, because our advisors are so nice. They invited us out. Um, it's a bit hard to see, but you see, it's like I got this really cool badge, and now I get to have it, and I get to put on my resume that I went to this conference. And I've participated in a lot of the different workshops that we have too. So as Toni was mentioning, we do have a Narcan 101 training. So here's my box of Narcan. It's kind of difficult with the light. And I participated in the mindfulness meditations too. So during those, Toni did not mention this, but you get a little roller ball that is filled with essential oil, and that one smells like mint. And before joining you guys, I actually rubbed that on my palms because it smells like mint, so it's kind of like brightening. It's the evening time, so maybe we're a little bit tired. But really, my experience with the center has been really great. I think that one of the more important things that I've learned is being able to connect with my peers in a way that I'm friendly with them, but also I'm providing them with information. So it is a volunteer position, but it makes me feel really good that I'm able to like really inform other students, and also because I know what they're going through as a peer, so I can kind of connect to them where they need to go, like whether it's our center, whether it's counseling center, or the other centers that Toni was mentioning. I personally really use the Latinx Resource Center, which is in the RISE suite. RISE stands for Rooted in Student Empowerment, since students were the ones who really advocated for that center. Um, And it's really great that a lot of the programs that we have here at UCI are really promoted by students, but they're really bolstered and supported by a lot of the pro staff. And that's another thing, getting to work with professional staff like Toni, and like the other advisors in our center is really good, especially as an undergraduate student. I think it's given me more confidence to be able to speak with my professors or other people that I want to work with. I actually just got into a lab, so I had to reach out to that professor and talk to her, but I felt confident going into that, being able to express what I wanted, and really just communicate effectively with her. We in our team just talked about communication and communication styles and being assertive rather than aggressive. So yeah, I've learned a lot. I think if I were a parent being here today, I would definitely urge your students to get involved somewhere on campus. I know that there's a concern that at UCI it's not a very social school or something like that. Um, but I think if you are a student and you want that social aspect, you really have to kind of go out and get it. But there are plenty of opportunities. I'm not even sure how many student organizations, student-led clubs there are because there are so many. Me personally, I'm the treasurer of Military Connected Community. So shout out if you are military connected, if you are a veteran or otherwise. But there are so many clubs. So they're based in what your interests are. So there are interest groups based on your like demographics, for example. MyS is like Latinos in STEM. And when I was a math major, was actually part of that. I've kind of transitioned out, but that's all to say that there are a ton of opportunities for your student to be engaged on campus in a way that's meaningful and that is going to really support them socially, but also academically. Um, that's another thing. I saw an upward trend in my academics when I started being more involved in school and also getting to learn things that are really important, like resilience and time management, which are workshops that we host with our center, as Toni mentioned. But there's skills that can be built. So I would say urge your students to get involved, not only with our center. I would say yes, our center, because it's amazing. I might be a little bit biased, but just on campus in general. Yeah, okay. I think I think I hit all the points that I really wanted to talk about. But I will be passing it on to Dani, who is our graduate student intern at our center. And I think she's going to be talking a little bit more about a specific program that we do. Thank you.
Thank you. Hi, everyone. My name is Dani Bryant. I'm a second-year grad student in the public health department at UCI. And my role here in the center is being a grad assistant, particularly being a program evaluator. So I evaluate two of the programs that we have at the center. So the first one is called Behind Happy Faces. It's an interactive workshop that helps students understand the ways that mental health can be challenged and how to identify effective coping strategies for yourself and for others. This workshop exposes participants to understand mental health in their own lives, as well as emotional relationships with others in their lives. There's a lot of different components of this program, but many express gratitude for one specific part where students share stories with others about things in their life that they're struggling with. And once these are shared with others in a safe space, it illuminates the shared nature of these human struggles, and it helps these students know that they're not alone. I would say out of this whole program, which is like 2 hours, this is the thing that students have vocally expressed gratitude for, just because it helps them know that they're not alone and there's resources out there. The second program that I help evaluate is called Step Up Bystander Program. This is a pro-social behavior and bystander intervention program. So it helps educate students to be proactive in helping others when they see someone else going through a mental health struggle, or just knowing the right steps to identify that and to intervene. So it teaches people about the determinants of certain behaviors, and it helps them know when to step in, and it makes them feel confident to step in. I think that's the most important part, is just having confidence in your skills to help others. And as a result, our goal is that they feel, like I said, confident to help in the future. So kind of talking about my role as a program evaluator at the center, a lot of it is just data entry, because these programs go on throughout the whole year. The director of the center, Doug, does a lot of these with athletes, and then Toni does these programs as well. So anytime they do these programs in different sessions, I input all the data from the year and conduct analysis for frequencies, trends, changes, anything like that. This kind of just helps create a narrative for the student body, so we're able to understand the struggles that they might be going through, whether it's mental health, finances, family issues, whatever it is. It's anything under the sun, because everyone is different. But it's also important to have this data to understand specifically the little target areas that we could potentially intervene with. Something cool that I'm currently doing is a longitudinal, kind of more large scale data analysis, because we've been doing these programs, Step Up and Behind Happy Faces, for over 6 years now, and no one has ever looked at the trends from all these years. So that's what we are doing this year. We're particularly examining the impact of COVID-19 on student mental health before and after the pandemic and returning to school. And even already, you probably assume that there was a negative impact with COVID-19, with mental health, family issues, sickness, whatever, which is true. But of course, you need data to back that. So that's kind of what we're doing right now, is just having the data match the narrative that we are seeing. Also, another interesting aspect is disaggregating the data based off athletes and non-athletes, because every athletic team at UCI has to do these programs. So it's not just students that want to do it, it's also athletes. So it's interesting to see the differences with that, because mental health in athletics has been a very big thing for the past 10 plus years. It's gotten a really specific spotlight. So we have been able to have athletics participate in these programs as well, which is not an easy feat. But with that data, we're also able to see if they go through the same thing as the general student body. Kind of explaining my day-to-day, like I said, it's a lot of entry data, student data. Aside from data, though, we also collaborate with different departments and student organizations with different surveys that we have to gather insight about specific populations that are sometimes underrepresented in data. That's something I'm really passionate about, is health equity. So it's always making sure that everyone is included, especially with data. People are just historically misrepresented or undercounted. So we want to collaborate with specific groups at UCI or departments that have a better understanding of specific groups or demographics. And we're currently doing that now with our Wishes survey, which is not one of these programs, but it's a different survey where we are hoping to help with specific demographics that have shown specific struggles throughout the school year. What I like about the job is just the opportunity to learn and grow. I'm not doing this as a practicum. This is just a part-time job for me, but there are 2 graduate students that are using the center as a practicum, as well as 1 undergrad student that I know. But the common thing with all of us is just learning and growing and having opportunities. It's nice to be able to contribute practically and build on my expertise as I enter the work field in June. Wish me luck. And it's just a reminder that every contribution plays a bigger role and contributes to the bigger picture. Thank you for listening, and I'll pass it back to Christine.
All right, thank you everyone, Toni, Damaris, and Dani, for sharing your experiences. And it's really enlightening to see like all of the activities that are going on within student health and wellness. We had some questions from parents that I'll just kind of bring up, and then Toni, you may be able to assess, if it's something that you want to address or the students. But kind of one of the big overarching questions is, for parents, they have a concern about students finding their confidence and finding a way to resist peer pressure. So is that something that is incorporated in any of the programs that you offer?
Absolutely. Yes. So that's definitely something that we've heard from our own students and through the data that we collect in our programs. And when I hear about confidence, another way that students kind of bring that to me is they talk about imposter syndrome. And so we work on that a lot. And really, it's a lot of reminding that one, you got accepted here, that you belong here. And two, really helping them sort of bring out their strengths. And there's lots of ways that we do that. And so if a student comes to me, that would fall under my topic for emotional well-being. And so we might do something like the VIA strength survey. I might just do like an informational interview. Maybe I'll do some journaling exercises with them. But that's definitely something that is, I would say, a pattern in what I see with the students here. And so really it's just reinforcing, one, that they belong here, and then two, that they have strengths, and we just work on bringing them out. And then the second question about the peer pressure is maybe Damaris, since you're a peer and you can talk about that. We definitely cover that. Cassie's our alcohol and other drug health educator, and she has a alcohol and drug kind of 101, just common scenarios of what students might expect. So she does cover things like scenarios of what to say or what to do in those situations. But I'm curious, Damaris, if you have any insight, being that you're a peer, if you've ever dealt with that.
Yeah, so I am actually happy to say that I haven't personally experienced peer pressure. I think I've kind of tried to surround myself with people that I really trust in my friend group. So I haven't really had that experience of other like people like my friends trying to pressure me into doing something that I didn't want to. I would say at our center, like you mentioned, Tony, that is something that we talk about, especially with Cassie, who is the alcohol and other drugs peer advisor for that program. And really, what we do is try to educate students so that they can make the best possible choices for themselves. So we talk about like standard drinks and how alcohol metabolizes and how much time that takes. We talk about things that you can do to try to avoid having like alcohol poisoning or signs of alcohol poisoning, so that if you are in a situation where you see somebody else who might be struggling, you can try and help them. Of course, the police should get involved in that situation, but you can do what you can in that time to help that person. So I think we try to, as you said, it's like a harm reduction program. So we try to really educate people so that they can make those decisions. But I haven't personally experienced peer pressure, luckily. So I hope that that's not something that your students will. It could happen. But I would say try and talk with your kids, your students, since you guys are parents, about, yeah, having the confidence to be able to say no. One of the communication skills that we talk about in dialectical behavioral therapy is Dear Man, but also there's another one called, I think it's, I think Tony, you might be able to answer this better. I think it's Fast, where it's basically you are making decisions that are value driven, and being able to say no in a way that's assertive, but you're still maintaining your own values. So talk to your students about what they value, so that they can make those value driven decisions, and also being confident with themselves and surrounding themselves with people that are going to be good for them, rather than just seeking attention from people that might be a bad influence. Even though we are at UCI, unfortunately, I think those people are everywhere. So just urge your students to be safe. Even if they can't totally abstain from alcohol or things like that, urge them to be safe. Because as a college student, I do see that there are parties, that there is alcohol, but yeah, so tell them to be safe. I would say it's important to have those conversations, especially at home, to kind of build comfort like with your students, so that if they do experience something like that, they can go and talk to you without feeling like they're going to be like in trouble with you, or something like that. That is my opinion. Thank you.
Thank you. I mean, that's a wealth of information, not just about, what you have there at the center, but just what students are facing and how they're able to cope with some of those challenges. I think what may be related is another question about how students can develop interpersonal skills, right? So that will also help build confidence. But are there any other programs or conversations or resources where they can learn to feel a little more confident socially and interpersonally?
Mm-hmm. And thanks, Christine. So that's definitely also something that we're seeing is students wanting to build up their interpersonal skills, their communication skills. We're also seeing students who say they feel really lonely, like they don't belong. And so what I would encourage in that situation, and Damaris alluded to this earlier, but just encourage students to really get involved. And that's why we try to create so many opportunities for our students to get involved, and we're trying to sort of make them more social and feel more casual so students can feel like they can make those connections. But really, if it's not our center, I would say just anywhere on campus, if you can think of an interest, there's a club for it. If it's like gaming or if it's Pokemon or anime or sports or whatever it is, there's so many organizations and clubs that are run by students. And I think that is a really great way to sort of gain those interpersonal skills, make those social connections, is by joining that club, sort of meeting on that common ground and having that interest in common with the students, and then just letting the relationships, the friendships or whatever grow from there.
Excellent advice. Excellent advice. Yeah, and I think, maybe some of your programs have produce their own opportunities for, socialization and meeting new people. When it comes to things like yoga and meditation, are there groups that regularly meet, or do people normally pop in for a one-time session? Like, how does that normally work?
Yes. So when it comes to yoga, meditation, any of our mindfulness programming, we do have regular meditation groups. So right now, just from our center alone, we're going to be offering 2 starting next quarter. So we do one on Mondays and one on Fridays at the beginning of the week and then at the end of the week. And we actually do that at the Cross Cultural Center. So it's a partnership with them because the Cross Cultural Center is so plugged into so many different clubs, just like the ones we were just talking about, and so many cultural hubs and different student groups. And so we want to have it at their space to really expose as many students as we can. And it's a really casual, sort of great for beginners place to learn meditation and to practice mindfulness or yoga. And then we also have in our student center a meditation space, and that's open to all students. I think it's like 7 a.m. to 7 p.m. So it's for students to practice meditation. It's also for students to practice any spiritual or religious practices they have, and it's massive. So that meditation room is right in the middle of the student center. And then aside from our department and the meditation room, there's just lots of little like pop-in meditation groups and trainings that are offered throughout campus as well. And then specifically for yoga, if your students go to or plan on going to the gym that we have, which is called the Arc. It's like a beautiful state-of-the-art gym that, I remember like Kobe Bryant used to train there for the Olympics. Like it's an awesome gym. They have group exercise classes, like they have yoga and they have Pilates and lots of different like pickleball and lots of different exercise classes as well. Another great place to build community, to make those social connections is to go to the ARC. So yeah, to answer your question, there's lots of opportunities for mindfulness, meditation, for yoga, all that stuff.
No, that's great. And it's wonderful that you're partnering with these other groups across campus to make this possible, you know, because that's how you make things available for people who are, you know, housed in various areas of campus. So we're getting a thumbs up. So great job so far, Toni and team. So yeah, some of the other questions. I mean, I guess one of the main questions a lot of parents ask us sometimes in parent and family engagement is, how do students learn about the events and the services that are taking place? So is it email, social, like what are the avenues that they hear about it?
Mm-hmm. So that's kind of the $1,000,000 question. And I'm very disappointed when I meet a student and it's like they're in their 4th year or their last year and they had never even heard of the center, right? And so we try our best. We actually have a designated marketing coordinator who does all of our social media, does all of our marketing, does all of our flyering, graphics. So we try to use all of the platforms, email, it's campus groups, which is sort of a portal that all students have access to. We use social media, TikTok, Instagram, all of the other ones. I don't even know the names of some of them, but we really try every medium and platform we can to try to get our students aware of just not our resource, but really all of the other great resources that they have available to them. A big one is SPOP. So if you are an incoming student, you probably are going to experience SPOP, where you will get a wealth of information. It's like drinking water out of a fire hose. That's how much information you get. But what I'll say is keep that information. I know that at first, when your student, or SPOP is for parents too, right? It's parent orientation as well. As a parent or as a student, keep all of that information handy. And then when that time comes where your student comes to you and says, okay, you know, I want to get involved, can you help me find some resources? That's when you can take that information out. So you'll get lots of valuable information when you go through SPOP if you haven't already, including a module from our department. And then I would say just have your students, you know, follow all of the UCI Instagram accounts. The main at UC Irvine Instagram account is actually great. They post a lot of our stuff and a lot of other department stuff as well. So I would say social media is a great way to learn. And again, please encourage your students to check out our services.
Yes, one other avenue, right, is through parents. And so just keeping that conversation open. If you're aware now of these resources, share them with your student, share them with other parents so that they can then have those conversations at home or over the phone, just to make students aware because, yeah, I mean, life is pretty busy on campus, right? So it's hard to keep track of everything that's going on, and that's just one way for students themselves to stay informed, is through their family and through their peers, really. So I'm glad, you know, and similarly with our, you know, programs, we make every effort to reach as many people as possible, but you know, it's a tough aspect of our job, definitely. There was a very specific question. I'm not sure that you can answer this, but it was regarding concerns about whether or not drinks have been tampered with. Like, I'm guessing this is like in a social situation or somebody's going out. Any types of test strips that might be able to detect something. I don't know if this is something that you can answer or if it's something that you discuss.
So I think I know what you're talking about, and I'll speak to what I can about there is sort of a trend recently that Cassie, our alcohol and other drug health educator, was letting me know about, which is these fentanyl test strips. And I'm not sure if that's what the question is referring to, but there is conversation. It's not something that we are yet offering, but there is conversation around campus about students having access to fentanyl test strips. Again, as sort of a harm reduction approach to keep them safe. It really took a lot for us to do the Narcan 101 training for, opioid use and to actually be able to give students the Narcan. And so I imagine it will take a while for us to be able to give the students test strips, but that is something that is being discussed at our department.
Well, that was eye-opening for me as well. So yeah, thank you for sharing that. And I'm sure there are things that are always in development. And so we learn about something new on campus, either from students or from faculty about what's going on. And seems like your center is doing a great job of addressing those things as they arise.
We try.
Damaris would like to share something.
Just really quickly, Toni, you had mentioned the fentanyl testing strips, and I believe there is a club at UCI called End Overdose, and they also provide boxes of naloxone, and then they also do have those fentanyl testing strips. So yeah, they're not available at our center. I think Cassie is definitely working on making that happen, but they are available on campus through that club. You could probably look them up through their website if they have one, or on their social media.
Okay, and then, I think if any parents have any specific questions about, these like very targeted concerns, I'm sure they could totally, follow up with you, Toni, about what services are offered or what materials are offered as well. Because I think, each family has their own like different concerns or things that they've heard about from their students' peers, in terms of, some of the dangers out there. So we won't get to all of those specifics today necessarily. But one of the other things I was curious about, and I'm not sure if Dani can speak to this, really, really inspired by all of the like research and surveys that you're working on, Dani. And what's the goal in terms of presenting the findings from these? I mean, is this something that will be shared with the campus public or the university itself? Dani?
Yeah, I think it depends on the content. Like with our wishes survey, where we're working with a specific group. We don't want to share that data until we have like collaborated with different departments and everyone is agreeing on the narrative that we're going to put out. But with the two programs that I talked about earlier that are around mental health, once I'm done at the end of the year and talk to the director that I work under at the center, we are going to disseminate that, especially the 6-year one, to see the trends and the changes throughout the years with the student body.
Great. Thanks for sharing that. I appreciate it. Something that's a little bit off topic, but I think it's an interest and a concern for a lot of parents is education around nutrition and how to keep your body healthy in that respect. So what types of programs are available that way?
Yes. So that's a great question and something that we see a lot, which is why we have Jody. She's our registered dietitian, and she does lots of programming and education around nutrition. And she works from a very sort of inclusive lens. And so she's, she doesn't even say that she's body positive. I think she says she's body neutral, right? And she sees food as just food. And so she really invites whatever you're dealing with, all sorts of students, even students who have dealt with disordered eating, she works with. And she's so great. She doesn't stigmatize, and she really talks about food and nutrition in an approachable way. And so one example is the workshop that she does, like called Healthy Eating on a Budget, where we have a Trader Joe's just right across the bridge, if you didn't know. And so she will literally go to Trader Joe's, take pictures, and then just create a list for students of things they can buy, how much they cost, and then also different recipes with the things that you bought. And she'll even say like, okay, you can do 10 meals for, $5.99 or whatever it is. And so she really works with students on whatever their individual needs are. And she's really mindful that students might not have a kitchen, right? If they're in a dorm, or they might not have, lots of money to go grocery shopping, right? And so she takes all of that account, really looks at nutrition from the student lens, and provides approachable, really accessible information. Another workshop that she did recently was she actually went to Arroyo Vista, which is one of the housing communities here at UCI, and she did like a little demo on how to make overnight oats with them, and actually just brought everything. So the students like had to walk 10 feet, right, from their dorm. They didn't even really have to go anywhere, but she just did a little cooking demo with them. And so she tries to make things as easy, as seamless as possible. She has 2 older kids of her own who went to college, so she knows sort of the information that students need when it comes to nutrition and body image. And the last thing I'll say is we all are just really involved with this different initiatives on campus. So she has like a energy drink task force where she makes sure that all of the energy drinks that are sold on campus have X amount milligrams of caffeine. So your students are not, potentially harming themselves. I'm sure you've all seen in the news where students are drinking too much of these energy drinks, and it gets to a pretty dangerous level. And so she does things like that. She's always at Zot and Go. It's a little convenience store. We have a student center, just making sure all the food in there, right, is meeting certain criteria and meeting policy. So it's definitely something that that she takes seriously and that we talk about a lot at our department.
That's really good to know. And then, just equipping students with that information is so empowering. Do you also work with the Basic Needs Center in terms of for students who are food insecure that would need those services?
Yes, so the Basic Needs Center is one of our campus partners that we work very closely with. And anytime students present to us with food insecurity or even housing insecurity, we'll work with the Basic Needs Center and have really great contacts over there.
And then there's another question I'm not sure you're able to answer or how this is dealt with. But a professor or a TA may kind of identify something within a student where they may need some extra help, or they see that they're in need of some guidance. What are the steps that they usually take to help a student out?
Yes, so we know that oftentimes professors or TAs or learning assistants or whoever are maybe the first to recognize a change in behavior or notice that a student might be struggling and need that extra support. And that is a lot of the work that we do. Is we really try to build relationships with the different schools, like the School of Biosci and Social Ecology, and try to share what we call passive education, which is really just our information, like maybe one slide that they can put up in the class as the students are coming in. Or maybe in their syllabus, it's just a line about our department or a line about all of the different resources like the counseling center, us, social work. And so, of course, we don't have every single professor who has agreed to this, but we are actively working to get our faculty on board with having well-being sort of be everywhere on campus. That's one of the initiatives that our director, Doug, is really working on, called the Comprehensive Wellbeing Initiative. But we're really working hard, and we have some great faculty who do a great job at referring to us or referring to the counseling center. And sometimes a lot of the faculty will just refer to the counseling center, and then sometimes the counseling center will then refer that student to us. So really, it doesn't make a huge difference which resource they go to, just as long as the professors really know what's out there and can refer. That's what we care about. And so we're really actively working hard to build those relationships with faculty. And a lot of them really have already committed to that passive education or listing us on their syllabus.
Well, that's really excellent news. I didn't even think about that as an option, but that's just such a great way of making it accessible to everyone without having to have those individual kind of like, difficult conversations, so that students just know where it is that they can go if they need help. So we're kind of, we're at the end of the program. I wanted to thank you all for coming and for sharing your different areas. Such amazing information, and I think it's really helpful for parents and students. And before we get going, we'll just share a slide with some contact information. So here we have the contact for your area, the Student Health and Wellness Promotion here. So that's the website there, and I'll have, I'm sure, an email as well within that website. Now, as Toni mentioned, their center is not necessarily dealing with the clinical side of things. So if you feel that your student may need some, counseling or something a little bit more clinical, there's also the counseling center on campus, and Toni's team works with them as well. And if you have any questions just in general about UC Irvine and parent and family engagement, you can reach us through our website. And please, keep an eye out for our newsletters, where we share a lot of information there too. This coming Monday, we'll be having another webinar that I'd like to plug, and it's with our Division of Career Pathways. So that's going to be another educational webinar for you to check out. I think we may have had a slide on that, but if we don't, we'll be sharing that information out in our follow-up message from this event. Oh, here we go. Okay, so there's the QR code for the Career Pathways webinar. So yeah, we're really happy to be here, with our campus partners, sharing all of the good work that they do. Really, these are the people with the boots on the ground, just like communicating with your students and making sure that they're healthy and well educated about, how to kind of maneuver the challenges of going through college. So you have the contacts, you have our contacts. We look forward to seeing you on the Career Pathways webinar. And then also just a quick reminder, if you are a parent who wants to support any of the areas with a gift, regardless of any size, we have Giving Day coming up on April 16th, where we'll be highlighting a lot of different areas of student affairs on our parent campaign page. So that will be shared soon, but I just want to let you know that that's coming up April 16th. The Counseling Center is one of the areas that we're featuring, and there are multiple other areas that we're talked about here that Toni's team partners with, that would definitely appreciate the help in terms of, some of the programming costs that they have. So really grateful for everybody's attendance. Again, thank you to our presenters, Toni Martinez, Dani, Bryant, and Damaris Cervantes. Really appreciate everything you've done. We're gonna end here, putting everybody that we can on video from our panel, and if we can just zot out together, that would be fantastic. So let's get our zot signs ready. And the parents, wishing you well, wishing you a good evening. And on the count of 3, 1, 2, 3, zot, zot, zot. Thanks, everyone. Hope you have a great evening. Bye-bye.